Before you take your next over-the-counter pill, you need to hear this. A growing body of research suggests that some of the most common medications in your medicine cabinet may be linked to an increased risk of dementia. But what does the science really say? And should you be worried? I'm Dr. Vivian Hart, and today we're going to separate the facts from the fear, one medication at a time. And trust me, the answer is more complicated and more empowering than you might think. Welcome back to Health Education Hub. I'm Dr. Vivian Hart. If you or a loved one are over 60, you've probably seen the headlines. They're designed to scare you. This common drug raises your dementia risk by 50%. The pill in your cabinet that's destroying your brain. And it's natural to feel anxious. After all, dementia is one of the most feared conditions of aging. But here's the problem with those headlines. They often simplify a very complex picture. They trade nuance for clicks, and in doing so, they can cause more harm than good by making people want to stop their essential medications. Today, we are going to do the opposite. We are going to look at the actual evidence, the studies, the meta-analyses, and the clinical guidelines to understand what the science really says about 9 popular medications and dementia risk. And more importantly, we'll talk about what you can actually do with this information. Because knowledge isn't just power, it's the foundation of better conversations with your doctor. Let's start with the class of drugs that has the strongest, most consistent evidence linking it to dementia: anticholinergics. These are medications that block a neurotransmitter called acetylcholine, which is critical for memory and learning. A 2025 meta-analysis found that patients taking anticholinergic drugs for overactive bladder had a statistically significant 20% higher risk of dementia. That's a real association. Another large study from the UK Biobank, also from 2025, found that any prescription of anticholinergic medication was associated with a 15% to 23% increased risk of dementia. But here's where the nuance comes in. The risk isn't the same for everyone. It depends on the specific drug, the dose, and how long you take it. A 2025 study on overactive bladder medications, for instance, found no increased risk in adults aged 18 to 64. So age and cumulative exposure matter. And the absolute risk is still relatively low. But the association is real, and it's why organizations like the American Geriatric Society recommend avoiding these drugs in older adults when safer alternatives exist. Now, what are some common anticholinergic medications? This is where it gets personal. Many are over-the-counter, which is why the title of this video mentions that number 7 is in every medicine cabinet. First-generation antihistamines like Diphenhydramine, you know it as Benadryl, are classic anticholinergics. So are sleep aids like Sominex and nighttime cold medicines like NyQuil. A landmark 2015 study in JAMA Internal Medicine found that people who took Diphenhydramine daily for at least 3 years had a 54% higher risk of developing dementia. That's a striking number. But before you throw out your Benadryl, let's pause. This is an association, not causation. The study showed a link, but it couldn't prove that the drug caused the dementia. It could be that the conditions these drugs treat, like poor sleep or allergies, are themselves linked to a higher dementia risk. This is what scientists call confounding by indication. Still, the evidence is strong enough that many experts recommend using these drugs sparingly, especially in older adults. Next, let's talk about benzodiazepines. Drugs like Xanax, Valium, and Ativan are widely prescribed for anxiety and insomnia. A 2025 population-based study found that benzodiazepine use was associated with a 65% higher risk of dementia. Long half-life agents like diazepam, Valium, were linked with a doubled risk compared to short-acting ones. But, and this is a critical but, Another 2025 study concluded that benzodiazepines do not appear to be a significant risk factor for dementia. So we have two studies, both from 2025, coming to different conclusions. How is that possible? The study that found a modest risk attributed the association to confounding due to higher rates of diabetes, cardiovascular disease, depression, and anxiety among users. In other words, it might not be the drug itself, but the underlying health conditions that drive the risk. The authors still caution against long-term use due to tolerance, dependency, and adverse effects, but they didn't find a strong dementia signal. This is a classic example of how science works. It's messy, it's contradictory, and it requires us to look at the totality of the evidence rather than latching onto a single headline. Now, let's move to a medication class that's in nearly every medicine cabinet in America: proton pump inhibitors, or PPIs. Drugs like Omeprazole, Prilosec, Omeprazole, Nexium, and pantoprazole are used to treat acid reflux and heartburn. The concern about PPIs and dementia has been circulating for years, but the most recent and comprehensive evidence tells a different story. A 2025 systematic review and meta-analysis found no statistically significant association between PPIs and dementia. An umbrella review of systematic reviews, also from 2025, concluded that most SRs/MAs suggest no link between PPI use and dementia. The authors noted that a true causal relationship appears unlikely. So while the fear about PPIs persists, the current weight of evidence suggests they are likely safe regarding dementia risk. This is a perfect example of how initial concerns, often based on weaker observational studies, can be overturned by more rigorous research. So far, we've covered three major classes, but there are others. What about opioids, antipsychotics, antidepressants? A 2025 study that examined polypharmacy, the use of multiple medications, found that antipsychotics, antidepressants, benzodiazepines, antihypertensives, and dopaminergics showed increased odds for adverse cognitive outcomes. Corticosteroids were also linked to an increased risk. This highlights an important concept. It's not just about individual drugs, it's about the cumulative burden of multiple medications, especially in older adults. The more medications you take, the higher the risk of drug interactions and side effects that can impact cognition. But it's not all bad news. The same 2025 umbrella review that found moderate certainty of increased risk with anticholinergics also found moderate certainty of reduced risk of dementia associated with antihypertensives, statins, SGLT2 inhibitors, and GLP-1 receptor agonists. So while some medications may increase risk, others appear to be protective. This underscores the importance of not stopping essential medications like blood pressure or cholesterol drugs without talking to your doctor. Now, let's talk about that number 7 medication, the one in every medicine cabinet. While we can't name it definitively in a video like this, the evidence points to over-the-counter antihistamines and sleep aids containing diphenhydramine, which is a potent anticholinergic. It's the active ingredient in Benadryl, Sominex, and many cold and flu remedies. The 2015 study showing a 54% higher risk with daily use for 3 years is a critical piece of evidence. However, it's important to note that the study looked at daily use for years. Occasional use for a few nights is very different. So, what does all this mean for you? Here are my 3 actionable takeaways. Number 1, have a brown bag review. This is a simple but powerful practice. Take all of your medications, prescription, over-the-counter, and supplements, put them in a bag and bring them to your doctor or pharmacist. Ask them to review your list. Specifically, ask, are any of my medications anticholinergic? Are there safer alternatives? Do I still need all of these medications? This single conversation can be one of the most important steps you take to protect your brain health. As Dr. Gray noted, the key point is for neurologists to ask about anticholinergic medications, particularly over-the-counter medications. Number 2. Ask the right questions. When your doctor prescribes a new medication, don't be afraid to ask, is this medication absolutely necessary? Are there non-pharmacological alternatives? What are the potential long-term risks, including cognitive effects? A 2025 study that examined criteria like STOPP-START and BEERS found that the absolute risk of developing dementia was 6.5% in patients who met the criteria for potentially inappropriate medications, compared to 13.4% in those who did not. That's a significant difference. Being informed about potentially inappropriate medications can help you have a more productive conversation with your provider. Number 3. Never stop medications abruptly. This is the most important safety warning. Abruptly stopping medications like benzodiazepines, antidepressants, or antipsychotics can cause life-threatening withdrawal symptoms. You should never stop any medication without consulting your doctor. This video is for educational purposes only. It is not a prescription to change your medication. Your doctor knows your full medical history and can guide you safely. I want to leave you with a final thought. The relationship between medications and dementia is complex. It's not a simple, this drug causes dementia story. It's a story about risk, benefit, and individual variability. For some people, the benefits of a medication far outweigh the potential risks. For others, safer alternatives may exist. The goal is not to live in fear of your medicine cabinet. The goal is to be an informed partner in your own healthcare. If you found this breakdown helpful, share it with someone who might need to hear it. There is a lot of fear out there, and a little bit of science can go a long way. Subscribe to Health Education Hub by Dr. Vivian Hart for more evidence-based health education. And leave a comment below, do you have a medication in your cabinet that you're now curious about? I read every single one. I'm Dr. Vivian Hart. Stay informed, stay safe, and I will see you in the next video.